Welcome back to another session of Understanding Human Anatomy. In this video, I'm going to begin a discussion of the structure of the heart, and we're going to start by looking at the exterior of the heart. So I want to sketch the heart in here, and bear with me because I'm going to have to do some erasing and filling in as we go. I'm going to start by just getting a nice outline of the heart. So we're going to start here, come over to the right, and over like so, and then complete our heart. Now, we have some other structures to look at, and what we'll do first is draw in the superior and inferior vena cava, which enter the right atrium. So up here will be the superior vena cava. Down here will be the inferior vena cava. So I'll put a label and abbreviate the name SVC for superior vena cava. And down here we'll have IVC for inferior vena cava. And what I also want you to realize is that the heart sits on the diaphragm, which separates the abdomen and the thorax, the abdominal cavity and the thoracic cavity. And the inferior vena cava in the thorax itself is very short, maybe 4 or 5 millimeters at most. So not much of it is actually in the thorax. Now, those are two major veins bringing blood back from the body to the right atrium. Let me draw in the arteries that take blood away from the heart. And one of those is the aorta. And I want to draw the aorta here, and then it will start into its arch. We don't have room to show the entire arch, but we can show the start. Okay, and of course that will be covering up the structure of the heart, so let me erase that line. And then we have to draw in the pulmonary trunk. The aorta carries blood out to the body. The pulmonary trunk carries blood to the lungs. So again, the pulmonary trunk is anterior to the aorta, so the pulmonary trunk covers up the origin of the aorta. And it divides into a right and left pulmonary artery. And the right pulmonary artery passes through the arch of the aorta. We can then sketch in a groove. We'll use a line to indicate the groove. And it's a groove between the atria and the ventricles. So I'm going to draw it right along here, like so. And this is the atrioventricular groove. Now, when you see it in the heart, when you're looking at a real heart, it's hard to see this groove, and that's because there are coronary arteries, there are coronary veins, and there is fat in here filling up the groove. But if you pick away the fat and then isolate out the artery and veins, then you can see the external distinction between the atria and the ventricles. And I'm going to draw in another groove down like so. And this is the interventricular groove. And again, it's filled with arteries, veins, and fat, so it's not easy to distinguish in all individuals. If the heart has very little fat on it, you'll see the blood vessels, so you'll see where it is, even though it doesn't look like a groove, a depression. But it's an external marking between the right and left ventricles. This is the right atrium. Letter in there. Okay, and it's the atrium that sits anteriorly. All the atria both atria have a sac-like appendage. And that sac-like appendage is called the auricle. And if we look at the right auricle, it will stick out kind of like so from the atrium. So again, let me do some erasing to clean up the diagram. And further, let me draw in a little bit of the left auricle, which will be peeking around from the posterior side of the heart. So if we look in this area, we'll see a little tiny bit of the left auricle, or the auricle of the left atrium. Let me do some coloring in here. Let me color the atria in pink, and let me close off the two Vena Cava. Like so, and then I can color the Vena Cava in blue to represent that they are carrying deoxygenated blood. Got to do a little erasure here on the pulmonary trunk. Touch up the line here. Let me also do a little cleaning up on the pulmonary arteries here. So we'll clean up here. And also on the aorta. So it's like so. And let me color in the auricle from the left atrium, also in pink. And I'm going to color the pulmonary trunk and the pulmonary arteries in a light purple or lavender to indicate that this artery is carrying a deoxygenated blood, and we'll color in the aorta in red to show that it's carrying oxygenated blood. Down onto the ventricles, let me color the ventricles in a brown. So we can distinguish the various areas. Now, as I said, this little appendage here is the auricle from the left atrium. So let's identify it. And we'll draw a line to it. And in purple, we have the pulmonary trunk and the pulmonary arteries. The pulmonary trunk branching into the left and right pulmonary artery. Then here we have the aorta. And this is the artery that's the output of the left side of the heart, bringing blood to the body. Over here we have the right ventricle. Which is sitting anteriorly. And the little bit of left ventricle, I'll draw the label off the heart and bring a line to it. This is the left ventricle. And remember that most of the left ventricle lies posteriorly, so that's why we're only seeing a small amount here. And then this line is the interventricular groove. And that's the external marking of the septum, the wall that divides the left and right ventricle. And then up here between the atria and ventricles, we have the atrioventricular groove. And that's represented by this line. So these are the major structures on the anterior side of the heart. That will conclude this video. In the next video, we'll look at the posterior and inferior surfaces of the heart. Thank you for your attention.